Okay, I want to talk to Sarah about the child welfare crisis that's been in the news lately.
Yeah, this is a crisis that, unfortunately, it's not really new. But there was a couple of stories. There were a couple of stories this week that with DHHS warning that the state could be sued really at any time for the handling of the foster care system. So here's the rundown. We have about 10 to 11,000 children in the foster care system. We think that's what we have. It's a little bit hard to get our arms around that because we have a fragmented system. Each of the 6 LME MCOs manage their own set of children, meaning that if a child moves from one county to the next, their Medicaid doesn't necessarily follow them, and they may not be able to get services. We have a huge money problem. We have increased rates for foster families in the state of North Carolina recently, but it's still not enough. A 2018 study said that our rate should be between $750 and $940. They're still sitting between $500
Some of
and
these
$600.
kids are sleeping on the floor in these offices, correct?
Yeah, that's correct. And that's because of all of these other challenges. So we have kids sleeping in DSS offices, we have kids sleeping in emergency rooms, and we have kids being sent hundreds of miles away from their families, being separated for as long as a year, maybe more in some cases, and quite frankly, also going to other states. So it's a huge issue. The state is keenly aware of this issue and has started taking some steps.
Okay.
In the last session, we reformed child welfare, making it easier to place children with relatives and non-relatives, and also requiring a review and permanency planning within 90 days of that first disposition. The state is also committed to creating a statewide system for foster care youth, and there are stakeholders been engaged in that discussion for months, and we should have a plan soon. I'm going to sound like a broken record.
Quickly.
Yeah, I'm going to sound like a broken record. Medicaid expansion would help. It would give more families more services.
She's on message.